ಸೊ ವಿಚ್ ಆರ್ ದ ಮೋಸ್ಟ್ ಇಂಪಾರ್ಟೆಂಟ್ ಥಿಂಗ್ಸ್ ಆಫ್ ಲೈಕ್ ಸ್ಕ್ರೀನಿಂಗಲ್ಲಿ ಯಾವೆಲ್ಲ ರೀತಿಯಾದಂಥ ಸ್ಕ್ರೀನಿಂಗ್ಸ್ಗಳಿದೆ ಅಂತ? ಒಂದು ಫ್ಯಾಮಿಲಿಯಲ್ಲಿ ಯಾರಿಗೋ ಒಬ್ರಿಗೆ ಕ್ಯಾನ್ಸರ್ ಇರುತ್ತೆ ಅಂತ ಅಂದ್ಕೊಳ್ಳಿ. ಈಗ ನನ್ನ ತಂದೆಗೆ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಕ್ಯಾನ್ಸರ್ ಇತ್ತು, ಅದು ಮಗನಿಗೆ ಬರೋ ಸಾಧ್ಯತೆ ಇದೆಯಾ ಹೆರಿಡಿಟಿಯಲ್ಲಿ?
This is a common question. I think every patient will say that we didn't have a family member with cancer. Why did I have cancer? Or the reverse, that I had this person having cancer. What is my chance? So remember that 90% of all cancers will not have a family connection, will not be heritable or will not be familial. But there are 10% patients who will have family history, will have one relative, parents, brother, sister, grandparents, your uncle, auntie who has cancer. What we again have to do is, if you have any family member who has cancer, get yourself again, have a discussion with your oncologist or geneticist. So please go and meet a doctor. Tell them that my mother had this problem or my sister had this problem and at what age they had, what type of cancer they had. Your doctor will tell you what is possibly your risk, or do you need to do anything specific to check whether you have a risk of cancer or not.
ಯೂಟ್ರಸ್ ಕ್ಯಾನ್ಸರ್ ಇದೆಯಾ? ಹೌದಾ? ಯಾವ ರೀತಿ ಅದು ಫಾರ್ಮೇಷನ್ ಆಗುತ್ತೆ? ಯೂಟ್ರಸ್ ಕ್ಯಾನ್ಸರ್ ಯಾವ ರೀತಿ?
See, uterine cancer is again one of the cancers which is becoming more and more common in India. Previously, it was cervix cancer. Cervix is the lower part of uterus, but now it is becoming more and more common, uterine cancer. Uterine cancer again is related to hormones. And interestingly, obesity, having excess body weight is the most important reason. What a woman will present is she has already had menopause, periods have stopped. Now she starts having spotting. Most often, an overweight person with reduced physical activity, may be having comorbidities like diabetes for a long time, sometimes may have family history, could actually have an ultrasound which shows the endometrial thickness is high, and that's when you suspect she could be having a uterus cancer or an endometrial cancer.
Which cancer is dangerous for women?
All cancers, if not treated, could be dangerous. Most of these cancers, if treated on time, could be curable. Whether it's breast cancer, whether it's cervix cancer,
High risk?
ovarian cancer, endometrial cancer. Most of them, if they are diagnosed on time, could be treatable. All of these, what I'm saying.
But what about high risk cancer?
All of these cancers are curable
which we
cancers.
can compare this to a bike. ಇಂಜಿನ್ ಕೆಟ್ಟೋದ್ರೆ ಕಷ್ಟಪ್ಪ ರೆಡಿ ಮಾಡೋದು, ಬೇರೆ ಟೈರ್ ಇನ್ನೊಂದು ಮತ್ತೊಂದು ಸ್ಟೇರಿಂಗ್ ಹೋದ್ರೆ ಚೇಂಜ್ ಮಾಡಿಸ್ಕೊಬೋದು, ಡೋರ್ ಹೋದ್ರೆ ಚೇಂಜ್ ಮಾಡಿಸ್ಕೋಬೋದು. ಇಂಜಿನೇ ಕೆಟ್ಟೋದ್ರೆ ಗಾಡಿ ಸರಿಯಾಗಲ್ಲ ಅಂತ ಹೇಳ್ತೀವಿ. ಸೊ ಆ ಥರ ಮನುಷ್ಯನ ಬಾಡಿಯಲ್ಲಿ ಯಾವ ಒಂದು ಆರ್ಗನ್ನಿಗೆ ಕ್ಯಾನ್ಸರ್ ಬಂದರೆ ತೀರಾ ಕಷ್ಟ, ದಟ್ ಈಸ್ ಅ ರಿಸ್ಕ್ ಫ್ಯಾಕ್ಟರ್.
Certain cancers are quite bad to have. If you have a pancreatic cancer, if you have a gallbladder cancer, it's known as biliary tract cancer. These are bad cancers to have. Lung cancer was assumed to be a bad cancer, but now with newer medicines, quite a lot has changed in lung cancer. These are some brain cancers, high-grade brain cancers. They are bad cancers to have.
ಮೇಡಮ್, ಆನ್ ಒಕೇಶನ್ ಆಫ್ ಎವ್ರಿ ಇಯರ್ ನೀವು ನೋಡ್ತಾನೆ ಇರ್ತೀರಾ, ವರ್ಲ್ಡ್ ಕ್ಯಾನ್ಸರ್ ಡೇ ಸೆಲೆಬ್ರೇಟ್ ಮಾಡ್ತಾನೆ ಇರ್ತೀವಿ. ಎಷ್ಟೋ ಅವೇರ್ನೆಸ್ ಮಾಡ್ತಾನೆ ಇರ್ತೀರಾ, ನೀವು ಕ್ಯಾಂಪೇನ್ಸ್ ಮಾಡ್ತೀರಾ, ಡ್ರೈವ್ಸ್ ಮಾಡ್ತೀರಾ ಅವೇರ್ನೆಸ್ ಕ್ರಿಯೇಟ್ ಮಾಡೋದಕ್ಕೆ. ನಿಮಗೆ ಯಾವತ್ತಾದರೂ ಅನಿಸಿದೆಯಾ ಇನ್ನೂ ಜನಗಳಲ್ಲಿ ಇದ್ರ ಮಾಹಿತಿ ಕೊರತೆ ಇದೆ ಅಂತ ಅನಿಸಿದೆಯಾ?
This awareness has changed things a lot. It has worked. So awareness, at least especially in patients who are educated, in population which is educated, has done a remarkable job. Every year there's a campaign which world health organizations run. So the World Cancer Day on 4th of February is a campaign run by UICC, which is again an international organization, and this time the campaign is United by Unique. It's a 3 years campaign from 2025 to 2027, which says that everybody requires personalized care. Everybody requires individualized treatment. As we spoke, that every cancer is unique and every person is unique, and therefore everybody needs to be having an individualized treatment. And when we talk about it, we talk a lot about genomics now. We talk about a lot of genetic makeup of an individual and genetic makeup of tumor. And that's what we are going towards. Awareness is the key. Whether you talk of a celebrity who has no hair and comes on a TV platform and talks about it, or you talk about a common person who actually wants to talk about their health, it's extremely important to come together.
ಸೊ ನಿಮ್ಮ ಸರ್ವಿಸ್ನ ಆಲ್ಮೋಸ್ಟ್ 22 years ಆಫ್ ಯುವರ್ ಸರ್ವಿಸ್ ಅಲ್ವಾ? ಆಲ್ಮೋಸ್ಟ್ 22 ವರ್ಷ ನಿಮ್ಮ ಸರ್ವೀಸು, ಲಕ್ಷಾಂತರ ಜನರಿಗೆ ನಿಮ್ಮ ಸರ್ವಿಸ್ ಕೊಟ್ಟಿದ್ದೀರಾ. ಫರ್ಗೆಟ್ ಅಬೌಟ್ ದ ಮನಿ ದ್ಯಾಟ್ ಈಸ್ ಎವ್ರಿಥಿಂಗ್. ಎಷ್ಟೋ ಲಕ್ಷಾಂತರ ರೂಪಾಯಿ ಖರ್ಚು ಮಾಡಿ ನಿಮ್ಮ ಹತ್ರ ಬರ್ತಾರೆ. ಅಟ್ಲೀಸ್ಟ್ ನಿಮಗೆ ಯಾವತ್ತಾದರೂ ಅನಿಸಿದ್ಯಾ, ನಾನು ಈ ಥರ ಒಬ್ಬ ಪೇಷಂಟ್ಗೆ ಟ್ರೀಟ್ ಮಾಡಿದ್ದು ಅದೆಲ್ಲೋ ಒಂದು ಕಡೆ ಅವರ ಒಂದು ಕ್ಯೂರಿಂಗ್ ಆಗ್ದಲೇ ಅದು ರಿವರ್ಸ್ ಎಫೆಕ್ಟ್ ಹೊಡೆದಿರೋದು ಇದೆಯಾ ಯಾವತ್ತಾದರೂ ಲೈಫಲ್ಲಿ? ನಿಮ್ಗೆ ಅನಿಸಿದ್ಯಾ ರಿವರ್ಸಲ್ ಎಫೆಕ್ಟ್ ಆಗಿದೆಯಾ ಯಾವತ್ತಾದರೂ? ಆ್ಯಂಡ್ ಯು ರಿಯಲೈಸ್ಡ್ ಅಯ್ಯೋ ನಾನು ಅದು ಮಾಡಬಾರ್ದಿತ್ತು ಅಂತ ಅನಿಸಿದ್ಯಾ ಯಾವತ್ತಾದರೂ?
See, we will always think that if we had this facility, I could have done this for this patient. Always, for me, every patient also connects to the doctor. Every patient has a relationship with the doctor, and that relationship could be for few months, or it could be for few years, or it could be for a lifetime. And for everybody, I want the best. Every doctor wants the best for the patient. Yes, if they don't do well, we will always think that what could we have done better. So there is always a scope of perfection. You could always improve on what you're doing. So yes.
ಸೊ ನಿಮ್ಮ ಜೀವನದಲ್ಲಿ 22 ವರ್ಷದ ಜರ್ನಿಯಲ್ಲಿ ಇಷ್ಟು ಕೆಳಮಟ್ಟದ ವಯಸ್ಸಿನ ಒಬ್ಬ ಮನುಷ್ಯನಿಗೆ ನಾನು ಟ್ರೀಟ್ ಮಾಡಿದ್ದೀನಿ ಅಂತಂದರೆ ಅದು ಎಷ್ಟು ವರ್ಷದ ಮನುಷ್ಯನಾಗಿರ್ಬೋದು ಮೇಡಮ್? ಅಂದರೆ ಮಗು.
See, the youngest age is less than 1 year. The patient, a small
Less
baby,
than 1 year.
a person who's just born could also have a cancer. So this is known as pediatric cancer. Cancer can happen in infants less than 1 year as well. And we have treated cancers who are just few months old. It could be a patient born with a tumor. It could be a person who just developed cancer in the next few months. So it could be as small as that. And we have cancer in patients who are 98, 99 and 100 as well. And right now I have a patient who's admitted in the ward who's 98 years of age. And he's taking tablet hormone therapy. And he's fit, fine, communicates well. We have patients who are managed in the house with tablet treatment and who do well, who have actually touched 100. So yes,
biggest risk alla?
From 0 to 100 is what I know. Nobody more than 100, but then this is what.
ಅಂಡ್ ನಿಮ್ಗೆ ರಿಸ್ಕ್ ಫ್ಯಾಕ್ಟರ್ ಕೂಡ ತುಂಬಾ ಇರುತ್ತೆ. ಯಾಕೆಂದರೆ ನೀವು 1 ವರ್ಷದ ಮಗುಗೇನೆ ಕ್ಯಾನ್ಸರ್, ಪಿಡಿಯಾಟ್ರಿಕ್ ಕ್ಯಾನ್ಸರ್ ಅನ್ನೋದು ಇರುತ್ತೆ ಅಂದರೆ, ಸೊ 1 ವರ್ಷದ ಮಗುನ ನೀವು ಟ್ರೀಟ್ ಮಾಡ್ಬೇಕಾದ್ರೆ ನಿಮಗೆ ಹೇಗೆ ಅನಿಸ್ತಾ ಇರುತ್ತೆ? ಯಾಕೆಂದರೆ ನೀವು ಒಂದು ತಾಯಿ ಹೃದಯಾಗಿ ಬೀಯಿಂಗ್ ಅ ವುಮನ್, ಸೊ ನಿಮ್ಮಲ್ಲಿ ಭಾವನೆಗಳ ಜೊತೆ ಕನೆಕ್ಟ್ ಆಗಿದೆ. ನಾಟ್ ಎವ್ರಿ ಡಾಕ್ಟರ್ ವಿಲ್ ಕನೆಕ್ಟ್ ಟು ದ ಭಾವನೆಗಳು, ಆ ಥರ ಅಲ್ಲ. ಸೊ ಮೈಟ್ ಬಿ ನಿಮಗೆ ಅನಿಸ್ತಾ ಇರತ್ತಲ್ಲ, ಆ 1 ವರ್ಷದ ಮಗುಗೆ ನೀವು ಟ್ರೀಟ್ ಮಾಡ್ಬೇಕಾದ್ರೆ ನಿಮ್ಮ ಮನಸ್ಥಿತಿ ಯಾವ ಥರ ಇರುತ್ತೆ?
It's hard to explain that. For us, it's equally important. I mean, for us, everything. We see the family, not just the patient, and see the suffering they are going through. And also, again, when you talk about pediatric cancer, when you talk about kids, there is also one more aspect which we need to know, that kids are resilient. Whatever happens, they also tolerate. It is not like a 25 or 30-year-old. A young child will forget what happens one day of suffering, second day they are happily playing. So they are both sides of the coin. When you treat a kid, you see the happiness, they don't try to forcefully suffer. They are actually taking it as easily as it comes. Whereas an adult will probably add a lot of their own agony that, oh, my family is happening, I could not do my work, I could not do this. So there's a lot of difference how you manage a kid and how you manage an adult.
ರೆಸ್ಪಾನ್ಸ್ ರೇಟ್ ಹೇಗೆ ಮ್ಯಾಮ್ ಮಕ್ಕಳಲ್ಲಿ?
So kids have very good response rate. Certain type of cancers, like even blood cancers. Most common cancer in kids are blood cancers. Acute lymphoblastic leukemia is the most common cancer in kid, which has very high cure rate. The same cancer, if it happens in a 30-year-old, may have less results, but in a child will have very good cure rates. There are other type of cancers, neuroblastoma, nephroblastoma, brain tumors, which happen in kids, and quite a few of them do very well.
Thank you so much. Finally, we made it. 1 hour ಆಲ್ಮೋಸ್ಟ್ ಈ ಪಾಡ್ಕಾಸ್ಟ್ನ ಸಮ್ಹೌ ಯು ಹ್ಯಾವ್ ಮ್ಯಾನೇಜ್ಡ್ ಆ್ಯಂಡ್ ವೆರಿ ಗುಡ್ ಕಂಟೆಂಟ್. ಹೋಪ್ ಸೊ ಈ ಒಂದು ಕಂಟೆಂಟ್ ಜನರಿಗೆ, ಪಬ್ಲಿಕ್ಕಿಗೆ ರೀಚ್ ಆದರೆ ತುಂಬ ಚೆನ್ನಾಗಿ ಕ್ಯಾನ್ಸರ್ನ ಅವೇರ್ನೆಸ್ ಜನಗಳಿಗೆ ತಲುಪತ್ತೆ. ಅಂದರೆ ಇದು ಇಷ್ಟೊತ್ತು ನಾನು ಕೇಳಿದಂಥ ಅಷ್ಟೂ ಪ್ರಶ್ನೆಗಳು ಸಹಿತ ಎಲ್ಲೋ ಒಂದು ಕಡೆ ಜನಸಾಮಾನ್ಯರಲ್ಲಿ ಅವರ ಮಾತುಗಳಲ್ಲಿ ಓಡ್ತಾ ಇರುವಂಥ ಪ್ರಶ್ನೆಗಳು. ಇದು ನಾನು ಒಬ್ಬ ಆ್ಯಂಕರ್ ಆಗಿ, ಒಬ್ಬ ಪಾಡ್ಕಾಸ್ಟರ್ ಆಗಿ, ಆ್ಯಸ್ ಅ ಜರ್ನಲಿಸ್ಟ್ ನಾನಿಲ್ಲಿ ಕುತ್ಕೊಂಡು ಕೇಳಿದಂಥ ಪ್ರಶ್ನೆಗಳು ಯಾವುವೂ ಅಲ್ಲ. ನಾನು ಒಂದಷ್ಟು ಜನರಿಗೆ ನನ್ನ ಕಮ್ಯುನಿಟಿಯಲ್ಲಿ ಪೋಸ್ಟ್ ಮಾಡಿದಾಗ ಬಂದಂತಹ ಪ್ರಶ್ನೆಗಳನ್ನು ನಾನು ನಿಮಗೆ ಕೇಳಿದ್ದು. ಸೊ ಕಮ್ಯುನಿಟಿಯಲ್ಲಿ ಯಾರೆಲ್ಲ ಕಾಮೆಂಟ್ಸ್ ಮಾಡಿದ್ದೀರಾ ಆ ಒಂದಷ್ಟು ಪ್ರಶ್ನೆಗಳನ್ನು ಆಯ್ಕೆ ಮಾಡಿ ನಾನು ನಿಧಿ ಅವ್ರ ಹತ್ರ ಕಂಪ್ಲೀಟಾಗಿ ಆ ಪ್ರಶ್ನೆಗಳಿಗೆ ಆನ್ಸರ್ನ ಹುಡುಕುವಂಥ ಒಂದು ಪ್ರಯತ್ನ ಮಾಡಿದ್ದೀನಿ. ಥ್ಯಾಂಕ್ಸ್ ಫಾರ್ ವಾಚಿಂಗ್ ದಿಸ್ ಎಪಿಸೋಡ್. ಇದೇ ಥರ ನೋಡ್ತಾ ಇರಿ. ಕ್ಯಾನ್ಸರ್ನ ಬಗ್ಗೆ ಮತ್ತೊಬ್ಬರು ಡಾಕ್ಟರ್ನ ಕರ್ಕೊಂಡು ಇನ್ನೊಂದಷ್ಟು ವಿಷಯಗಳನ್ನ ಮಾತಾಡ್ತಾ ತುಂಬ ಆಳವಾಗಿ ಪರ್ಟಿಕ್ಯುಲರ್ ಆಗಿ ಒಂದಷ್ಟು ವಿಷಯಗಳ ಬಗ್ಗೆ ಚರ್ಚೆನ ಮಾಡ್ತೀನಿ. ಕೀಪ್ ವಾಚಿಂಗ್. ಥ್ಯಾಂಕ್ ಯು. ಥ್ಯಾಂಕ್ಸ್ ಫಾರ್ ವಾಚಿಂಗ್ ದಿಸ್ ವಂಡರ್ಫುಲ್ ಎಪಿಸೋಡ್. ಸೊ ಇದೇ ರೀತಿ ಪ್ರತಿಯೊಂದು ಎಪಿಸೋಡನ್ನು ಕೂಡ ವಿನೂತನವಾಗಿ ವಿಶೇಷವಾಗಿ ನಿರ್ಮಾಣ ಮಾಡ್ತಾ ಇದ್ದೇವೆ. ಇದಕ್ಕೆ ನಿಮ್ಮೆಲ್ಲರ ಸಹಕಾರನೂ ಇರಲಿ. ತಪ್ಪದೇ ಸಬ್ಸ್ಕ್ರೈಬ್ ಮಾಡಿ ಕನ್ನಡ ಪಾಡ್ಕಾಸ್ಟ್. ಹಾಗೆ ಈ ವಿಡಿಯೋ ನಿಮಗೆ ಇಷ್ಟ ಆದರೆ ಮಿಸ್ ಮಾಡದೆ ಶೇರ್ ಮಾಡಿ ಆ್ಯಂಡ್ ಡೋಂಟ್ ಮಿಸ್ ಟು ಲೈಕ್ ಅವರ್ ಎಪಿಸೋಡ್ಸ್. ಥ್ಯಾಂಕ್ಸ್ ಫಾರ್ ವಾಚಿಂಗ್. ಸಬ್ಸ್ಕ್ರೈಬ್ ಮಾಡಿ ಆ್ಯಂಡ್ ಬೆಲ್ ಐಕಾನ್ನ ಕ್ಲಿಕ್ ಮಾಡಿ so that every episode is gonna be notified. Keep watching. Spread smile forever.